Good afternoon, everyone. Thank you for joining us. On today's briefing, we'll hear from Mayor Tom Barrett, Milwaukee County Executive David Crowley, Dr. Ben Weston, Associate Professor with the Medical College of Wisconsin and Director of Medical Services with the Milwaukee County Office of Emergency Management, Darren Rausch, Health Officer and Director with the Greenfield Health Department, and Interim Commissioner Marlena Jackson with the Milwaukee Health Department. Mayor Barrett, I'll hand it over to you to start us off today.
Well, thank you very much, Catherine, and good afternoon. It's been a busy couple days here as we receive word from the state and our partners that there will be more vaccinations that are coming through the state of Wisconsin. And I think as you've seen on the national news, this is probably going to pick up over the next several weeks. So our Commissioner Jackson, as well as everybody else at the Health Department, have been very busy. And fortunately, we have lots of really good partners as well. We're working to finalize plans for tapping into the Federal Emergency Management Agency's offer to support for our vaccination efforts. Fema has been working with the state, with us, with the county, and we've been participating in those discussions with Milwaukee County. And it really is impressive how all the partners have been focused on the single goal of to get as many people vaccinated as promptly as possible, as safely as possible, and as efficiently as possible. So Interim Commissioner Jackson may have more to contribute in a moment, but I wanted to share the direction we're headed. FEMA wants to support the local strategies the Milwaukee Health Department has in place now. And obviously we've got the site at the Wisconsin Center. So that's going to be key to our conversations, our continuing conversations with FEMA. In the near term, that means supporting this location at the Wisconsin Center. But there are more conversations going on. As springtime gets closer and we think we can do more outside, our goal is to do more outside. We also are very mindful of the challenges that we face in making sure that this vaccination reaches all parts of our community in an equitable fashion. So the FEMA support and reallocation of some staff from our testing efforts are helping us move forward with the mobile vaccination efforts that we have underway. We've talked about the two locations that we'll have next week. We plan on asking for more after that, but starting late next week, we will be out in the community and we will have more specifics to share later. I'm particularly interested in deploying mobile sites to address the glaring racial inequities that we continue to see in vaccination. So a very important part of our expanded efforts is the availability of vaccine. We are in constant communication with the state. And as I said earlier, the indications are positive as we look forward to the coming weeks. We are very optimistic, and not even guardedly optimistic. We're just downright optimistic that we are going to see more vaccinations. And I think as more vaccinations are approved at the federal level, that's going to open the floodgates even more and is going to allow more people to get vaccinated more quickly. And that is obviously our goal for everybody involved. But while we do that, our testing continues. And we continue to urge all those individuals who don't feel well or who have been in contact with someone who is COVID positive to make sure that they get tested. And yesterday we tested 461 people at American Family Field. We did 85 people at Northwest Health Center and 61 at the Southside Health Center. So please continue to seek testing if you are experiencing symptoms or think you may have been exposed to someone who was tested positive for COVID-19. As a reminder, the Milwaukee Health Department will adjust the schedule for COVID-19 testing at American Family Field starting next week. It'll be Monday, Wednesdays, and Fridays. And as the number of COVID-19 infections has declined in Milwaukee in recent weeks, the demand for testing has gone down as well. So the drive-through and walk-up testing facility at American Family will be open Monday, Wednesday, and Friday from 11 a.m. to 6 p.m. If things start going in the wrong direction, we can change that very quickly. But we want to make sure we're putting our resources where they are most needed. Right now, clearly our resources are most needed in the area of vaccination. But testing will also remain at the Northwest and Southside Health Centers. Beginning March 1st, as we all know, there will be a lot more people who will be eligible to receive the vaccine, including teachers and essential workers, childcare workers, and we'll have a lot more information literally in minutes or hours on that. because we're working very, very closely with our partners in the education field, with our partners at the state level, to make sure that, again, we are working as quickly as we can to get vaccinations into people's arms. So a lot's going on. And again, I think things are headed in the right direction, but we know that you still have to do all the basics: wear the mask, do the social distancing, and please, if you have the symptoms, make sure you get tested. So with that, I'm going to turn it over to our partner, County Executive David Crowley.
Thank you so much, Mayor Bear. Definitely appreciate your leadership. And as many of you know, yesterday I delivered my very first State of the County address. And while we are faced with unprecedented challenges in this past year, it is in the face of adversity that I've been seeing throughout all of our communities, seeing everyone lift each other up, keep each other safe, and really give us all reason to be optimistic about this upcoming year. Because honestly, we all have a stake in our county's future. And the only way that we'll be able to bounce back from this pandemic is by investing in equity and fixing the systems that have brought us here in the first place. And so again, we are all familiar with the dramatic disparities that have been highlighted by this pandemic. The gaps that we see in the health of our neighbors aren't inevitable. They exist because of structural racism. And we are seeing these two destructive forces play out. COVID-19 and structural racism wreak havoc each day during this pandemic. And that's why we are committed as a county to addressing the structural factors that contribute to this problem. Not only has this pandemic exposed the dramatic racial disparities in our communities, but it has further highlighted the vulnerability of local government's ability to fund local services, and has really amplified the urgency to secure a statewide solution to funding local government. When you look at Metro Milwaukee area, we account for more than 30% of the state's economic output, but we need the tools to make the necessary investments to continue growing and to create an environment that allows us to compete with other metropolitan areas, particularly for investments in people. And so a local option sales tax will provide our residents a voice and the ability to vote for a tool that allows us to capture the benefits of our own economic performance in order for us to invest in local priorities while also providing local property tax relief. And so when I think about Governor Evers' inclusion of local option sales tax in his budget proposal, it leaves me with optimism that we can really work together and give counties the tools that they need to provide property tax relief and fund the services that are so vital to everyone in our community. But to learn more about the local option sales tax and what to expect from Milwaukee County in the year to come, please check out the State of the County address on the Milwaukee County Executive webpage, our Facebook page, and YouTube. And we'll continue to share these updates related to our work, COVID-19 resources, and other information about where to get support if you need the help. And so staying true to our commitment to equity and serving our most vulnerable populations, we began vaccinating seniors and other state eligible program participants today at our Milwaukee County Emergency Management Vaccination Site, which is located on the south side at the Kosciuszko Community Center. And so our Milwaukee County Department of Health and Human Services and many of our vendors have been calling seniors and other state eligible program participants to schedule a vaccine appointment, and they continue to do so in the coming weeks. And so I really want to make sure that folks understand that this site is not a site that the public can make their own appointments, and it's not a walk-up site. Again, if you are already receiving county services and you meet the state eligibility criteria for both phases 1A and 1B, we will call you to schedule an appointment. And as part of this approach, we're reaching out to our most vulnerable neighbors first. And these are our seniors, individuals living with disabilities, and those who are currently receiving health and human services support. So I just want to say thank you to everybody who's hanging in there with all of us and being patient, and continue to remember the 3 W's: wash your distance, wash your hands, and wear a mask. And I'd like to hand it over to Dr. West.
All right, thank you, Mr. County Executive. Good afternoon. First to our numbers, we have had 97,630 confirmed cases of COVID-19 in our community, and now 1,055 individuals who've died in Milwaukee County. And we've had 106,000 people in Milwaukee County who've received at least 1 dose of vaccine. So that's about 11% of our population. With our new vaccine data this week now up on our dashboard, we saw continued vaccine distribution, though no change in rate of administration week over week. We're at about 3,700 doses of vaccine been administered per day in the county. We certainly hope to see increases on that number in the future. We continue locally to see promising trends in cases, hospitalizations, and deaths, as well as our percent positivity. On the vaccine front, we're optimistic that the new Johnson & Johnson vaccine will receive emergency use authorization in the very near future, perhaps even as early as this weekend. Another approved vaccine and the increased supply that it would bring would most certainly be welcome news for our county as well as the rest of the country. There are a few key important points to understand about the Johnson & Johnson vaccine. First, much as the other vaccines, it has undergone extensive testing and proven to be extremely effective in building immunity without significant safety concerns. It's been tested on tens of thousands of people from all over the world, different ages, races, different ethnicities, and found to be very safe. The common side effects are similar to the other vaccines that we've been seeing. Typically, no side effects at all, but less commonly, some mild flu-like symptoms for a day or so after receiving the vaccine. Of note, no participants who received Johnson & Johnson vaccine had any serious allergic reactions. The Johnson & Johnson vaccine does use a different mechanism than the Pfizer or Moderna vaccines that we're more familiar with right now. While those two vaccines insert a piece of genetic material, which builds a protein to help our body build immunity, the Johnson & Johnson vaccine uses older, more established vaccine technology that's used in many other vaccines. So it introduces an inactivated virus into our body, and that allows for the creation of antibodies to fight off future infections, COVID infections in this case. Importantly, the storage and administration of the Johnson & Johnson vaccine is quite different from Moderna and Pfizer. It currently requires only one dose, one shot, as opposed to the two shots separated out from Pfizer as well as Moderna. And importantly, it can be stored at more normal temperatures for longer periods of time, which makes it much easier to handle. And this makes it particularly conducive to mobile vaccination programs and other public type settings where handling of the Pfizer and Moderna vaccine can be quite challenging. Lastly, but very importantly, the efficacy of the vaccine in preventing moderate to severe symptoms is about 66%. That jumps to over 80% for preventing more severe symptoms. And very importantly, it was 100%. In every case, it was effective in preventing hospitalization and death from COVID-19. So this vaccine certainly showed high levels of protection, and that was also against the new variants, particularly when it was tested against the strain in South Africa. So the Johnson & Johnson vaccine having high effectiveness, particularly against hospitalization and death, being just a single dose and being far more flexible in its administration protocols will be very welcome, a very welcome addition to our current tools to fight the COVID pandemic and keep our community safe. So we look forward to the authorization, and we'll begin to integrate this vaccine into our workflows as soon as we possibly are able to. So thank you very much. Stay safe, and I will hand it to Darren Roush.
Thank you very much, Dr. Weston. It's a pleasure to join this afternoon to provide a quick data update related to the COVID-19 disease activity in Milwaukee County. I'll just start today by telling you that the data continues to decrease, and you've heard that from other speakers today on this briefing. We're seeing that decrease in both the entire population as well as with our children. But remember, even though that cases are decreasing, we still need to do the 3 W's. Wear a mask, watch your distance, and wash your hands. And with that, let's take a quick look at the data for this week. The graph here again reflects what I just told you moments ago. Our cases are decreasing, and we're seeing these very consistent trends in both the city of Milwaukee 7-day average as well as the suburban community 7-day average. And when we flip here momentarily to the kids report, we see a very similar trend. And that's good to see. We want to see the disease trending in that direction, and we continue to be happy that it's moving in that direction. Back to the whole county report, there was significant media attention earlier this week to deaths, and Wisconsin as a state had 2 days of consecutive days of no deaths related to COVID, and that was a very positive sign. But unfortunately, we have to understand that with any level of COVID-19 disease in our community, we will have deaths. And certainly we had a big spike of deaths both in the spring as well as in November and December. And it's nice to see that those deaths have been tailing off, but those deaths are still unfortunately happening in our community. We'll talk next about the reproductive number or the transmission rate. This is again the rate that we want to look at. We want to look at a number that's below 1 because that's indicative of transmission from a confirmed case to other individuals. And as a county, we're doing really well. That number is, approaching 0.75 as we look at the graph here. But unfortunately, when we break out this data by city and county, so we have the suburbs on the bottom and the city on the top, we see that the trend in the suburban communities is actually increasing for the transmission rate, meaning that there's more likelihood for sustained disease transmission in the suburban communities than in the city of Milwaukee. And so this will bear careful monitoring over the next several days to weeks, because that would be indicative of more disease in the suburban communities. We know that testing has been an issue that we've been tracking recently, and we know that that's been something that has been decreasing pretty significantly over the last several weeks. And certainly, while the data is pending, I will reflect that testing is about 1/3 of what it was at our high point back in early November. So we're seeing about 15,000 tests per week in the most recent week. And we know there's a little bit of data pending, but certainly testing is available, folks, and if you need it or want it or have symptoms, certainly seek out one of the community testing sites. Regardless of whether testing is up or down, the trends are positive and the trends are largely flat, which is a good sign as it relates to % positivity. I'll leave you today just kind of looking at the map overall throughout the last year of where COVID-19 disease has occurred. These are new cases of disease over time. And then again, to point out that disease is still occurring, although the rates are much lower in the most recent weeks, we still have significant pockets of disease occurring throughout the community. And really this map reflects more of the increased areas of activity in the suburban communities, which would match that transmission rate variable that we looked at previously. So that's the data for this week. Folks, I would like to end today by just making some comments about vaccine availability. Vaccine availability has been in the news a lot recently. We've certainly heard from state partners that they're optimistic that additional vaccine allocations will increase in the coming weeks, and that's very exciting. Whether it's the Johnson & Johnson vaccine that may be approved very soon, or whether it's increasing production of the other vaccines on the market, the Moderna and the Pfizer vaccine, we need more vaccine in our communities. The news of increasing vaccine is hopeful, but it still reflects that unfortunately our vaccine availability is quite limited. And it doesn't equal the overall capacity that we have to put shots in arms. We see that even when we look at our data within the county. As Dr. Weston mentioned, and I'll highlight, when we look at the vaccine data over the last 3 weeks, the vaccines going into arms in Milwaukee County is pretty consistently reflecting about 3,700 shots in arms over the last 3 weeks. This is specifically related to the fact that we aren't getting the additional vaccine that we really desperately need to meet our capacity. In Milwaukee County, to give you some transparency, local health departments expect to receive about 36% of our requested vaccine allocations for next week. What that looks like broken down is that the 11 health departments in Milwaukee County anticipate receiving approximately 5,900 doses for next week out of more than 16,000 doses requested. When we look at just the suburbs, we see that we anticipate receiving about 32% of our vaccine requests, or approximately 2,900 doses of the nearly 9,000 doses requested for next week. And just to bring it a little bit more local, here in the city of Greenfield, we will actually receive less vaccine next week. as compared to this week. We'll be receiving 300 doses instead of 500 doses. And I point that out just to speak to the inconsistencies with which vaccine is allocated because of the limited vaccine that's available. And until we get that real consistent vaccine allocation, this is a challenge for not only local health departments, but other community vaccinators. So all of this tells us that unfortunately the phrase eligible does not equal available continues to apply this week. And I certainly hope that some week in the future, I can tell you that that is not the adage of the week, that is not the phrase of the week. But unfortunately, at this point, eligible does not equal available. We know that on March 1st, several additional groups will be eligible for the vaccine. This is the statewide prioritization that has been addressed in more recent media briefings and was originally announced back in January. The additional groups being prioritized include education and childcare staff. It includes individuals enrolled in Medicaid long-term care programs, including public-facing essential workers, in addition to non-frontline essential healthcare personnel, and lastly, facility staff and residents that live in congregate living facilities. We know that these groups become eligible, and we're going to prioritize them based in the order that I read them to you, which means that the big focus coming up after March 1st will be on the education and daycare staff, or school personnel, put broadly. Unfortunately, because of lack of vaccine, some of these priority groups are going to have to wait a little bit. We know that the state guidance continues to reflect that community vaccinators should continue to prioritize previously eligible groups. The biggest group that we're trying to take care of now, both in Milwaukee County and statewide, is the group of seniors over the age of 65. Right now, statewide, seniors over the age of 65, 48%, nearly 50% of them have been vaccinated with one dose of COVID-19 vaccine, and 14% of seniors have received both doses of the two-dose vaccine series. Unfortunately, within Milwaukee County, our numbers aren't as good. At this point, only about 42% of our seniors age 65 plus have received one dose, and nearly 10%, 9.9% have a documented completion of the two-dose COVID series. And I share this information about seniors to point out that we need to work diligently to finish that priority group, to finish the vaccination for the priority group that has the most hospitalizations and deaths, while simultaneously planning to administer vaccine to educators. And collectively, we're working really hard to make those plans. I want to tell all school personnel in the county and in the area that we've been working hard to get you vaccine as fast as we can and as vaccine eligibility and availability permits. We're working collectively within health departments, health systems, medical clinics to create a strategic plan to vaccinate school personnel in the next several weeks. We acknowledge that the state of Wisconsin Department of Health Services has said we need to complete these vaccinations, and our goal is to complete them by the end of April. Certainly, individually, I hope we can get them done faster, but that is truly dependent on vaccine availability. So at this point, our allocations remain far too low to quickly vaccinate the educator group, but we have plans to vaccinate all of you. We just need the vaccine. And please know that we share your frustrations, and we certainly ask those eligible groups that will be becoming eligible on Monday to continue to be patient. And as soon as we get vaccine, we'll get it into arms in Milwaukee County. So thank you for your time and attention, and I'll now turn the briefing back to Catherine for the question and answer portion. Thank you very much.
Thank you, Director Rausch. And actually today we are fortunate to have Interim Commissioner Jackson available. She'll give a few brief remarks and then we will move to the Q&A.
Thanks, Catherine. So thanks too to Darren for really actually setting up the stage for just information I'm going to be providing today as it relates to the city of Milwaukee and our education, our plans for our education vaccinations. So as Darren had already shared, we know that eligibility does not equal availability. And so as of March 1st, when the larger 1B eligibility groups open up, the City of Milwaukee Health Department will make sure, as directed by the state, that we are prioritizing in that group education, including teachers and early childhood educators. So over the past couple of weeks, we have had multiple conversations with the city of Milwaukee with both non-MPS educators as well as MPS, as well as our early childhood representatives, to make sure that we have plans that are comprehensive and are doing our best to meet the needs over the next several weeks as we work to get this particular sector vaccinated. So beginning on Monday, as was shared, March 1st, the education group will become eligible for vaccine, and those educators that live or work in the city of Milwaukee can go to the milwaukee.gov/COVID-vax, which is our scheduling system, to schedule appointments for their vaccinations at the city of Milwaukee, Wisconsin Center. Know that once you register in the system, you will need to provide your place of employment, meaning the school that you are currently working at or that you will be working at. And when you arrive to the Wisconsin Center, you will also have to show your ID as it relates, again, to whatever space you are working in, whether that be MPS, non-MPS, or early childhood. We've worked to get our systems and our logic updated in our scheduling system for the screening questions that will be asked, to make sure, to do our best to make sure that individual scheduling in those systems are exactly who they need to be. I also want to really acknowledge some of the partnerships that have been created. And as Darren had also shared, there have been a number of health systems and pharmacies that have stepped up to offer assistance to help with this very large group. And knowing that partnerships and plans have already been made with some private schools as well as some other early childhood to get those particular populations vaccinated, and understanding that that work has been going on and continues to go on. The Milwaukee Health Department is really a part of a larger group of vaccinators that are looking to make sure that this group will be vaccinated. So again, just for clarity, beginning next week, March 1st, through the 7th, so 7 days a week at the Wisconsin Center, educators can go to the website to register for appointments. March 8th, which is the second week of eligibility for educators, we will be holding mobile clinics at North Division and South Division high schools that second week. And so more information to come as we finalize those exact times to get our workforce there. With that, also wanted to just give an update on our mobile plans. So as it relates to equity, next week, we will also begin our mobile work specifically at All Saints Church on Thursday, as well as St. Ben's Church on Friday. Those are two what we consider closed groups, not open to the public. Our goal in those spaces is to reach individuals 65 and older, and also address some equity, as we had noted in the past. That is the beginning, and again, what we consider a soft launch, because it is 2 sites. We anticipate doing around 500 vaccines between those 2 sites next week. And then moving forward in the coming weeks to increase that number to around anywhere from 1,000 to 2,000 mobile vaccines per week as vaccine becomes more available. So with that, just again reminding everyone as we continue to talk about vaccine and watching all of our numbers, to remember to wash your hands, wash your distance, and wear your mask. With that, I'll turn it back over to Catherine.
Thank you very much, and thank you for joining us today. Our first question is for you. It comes from Allison Durr with the Milwaukee Journal-Sentinel. She says, Commissioner Jackson, would FEMA essentially take over vaccine administration at the Wisconsin Center, and Milwaukee staff would then go into the community and to other smaller sites to provide vaccines? And is there any sense for when FEMA would start providing vaccines in Milwaukee?
Yeah, so first of all, we're hoping for a launch to partner with FEMA the week of the 15th is our tentative date. And the idea is that FEMA would be supplementing staff. So not taking over, not replacing, but adding to the total number of staff at the Wisconsin Center, which, yes, would then free up Milwaukee Health Department staff to move into mobile spaces.
Thank you. The next question is from Cassidy Williams with Fox 6, and I believe, Commissioner, this might be for you as well. She's asking, will teachers have to live and work in Milwaukee to make an appointment at the Wisconsin Center, or is it live or work?
It is live or work in the city of Milwaukee.
All right, we still have a few more questions as it relates to educators. Our next few come from Allison Durr with the Milwaukee Journal-Sentinel. Her first question is, how many doses have been requested for K-12 staff, and which type of vaccine is it?
So we have requested 10,000 doses for the city of Milwaukee, and that does include second doses. So we have been, it has been shared that we have guaranteed a little bit less, about half of that, but also have received good news that additional vaccine is planning on coming. Don't have those solid numbers yet, but know that there appears to be more coming for next week. As it relates to prioritizing which kind of staff, per the guidelines that have been set out, the priority is for educators and their support staff. So that would be individuals, teachers and individuals in the school buildings with the children who have interactions with children in the building.
Were you going to cover up on the other question? Yeah.
I'm sorry, Catherine. So as it relates to other groups, so Boys and Girls Club and other before and after school programs do also fall into the educator group and would be eligible March 1st. Also, are we considering sub-prioritization? So at this point, we are not considering that. Our goal is to get as many people vaccinated as soon as possible. And understanding that, again, we might be potentially getting more vaccine. We're hopeful that we can get some larger portions of those populations done in the early few weeks.
Excellent. Our next question is from Sharon Bajenda with CBS 58, and it's for Dr. Weston. She asks, do people who have had COVID and get a single dose of the vaccine produce more antibodies than people who have not had COVID? Could a single dose be enough? Why or why not? Could this help to vaccinate more people?
So to the first specific question about a single dose of vaccine versus infection, it's very hard to compare the two. Infection has quite variable immunity. If you have a mild infection, depending on your immune system, you may have strong immunity, you may have long-lasting immunity, or you may have weak immunity and short-lasting immunity. The vaccine seems to be much more consistent in its immunity. I think what we're maybe getting at with this question is this debate of, one versus two doses of the vaccine, and could we protect more people with one dose than with two doses? So for example, if the effectiveness of one dose is hard to say, and there's a lot of conflicting information out there. Some studies show it being around 50% effective. Others have shown it being as much as 90% effective. But even if you choose a mid-range, say it's 70% effective, you could protect 70 people with 100 doses as opposed to using 100 doses on 50 people and maybe protecting 45 or so with 95% efficacy. So that's the theory behind the one dose versus two dose. I think it's something certainly to look into. The science so far has really focused on two doses. It's probably worth looking deeper into one dose versus two dose, but the science is not terribly clear right now on which is more beneficial on a broad scale.
Our next question is from Courtney Sisk with WISN 12. Her first question is, I believe the first walkthrough at the American Family Field was supposed to happen this week. Has it happened? If so, how did it go? And what will happen between now and opening day in April to allow fans back into the ballpark?
Yeah, so the walkthrough is actually scheduled for tomorrow. So it has not happened yet. And we are working really hard with American Family Field and the Brewers to make sure that all the appropriate mitigation steps are in place. And that includes really making sure that entries and exits are monitored, and also understanding spacing within the actual space as far as seating is concerned. So lots of things to still consider, but really hopeful and optimistic that we'll have people in the stands in April.
Courtney has a follow-up question. She asks, the COVID test site is going down to 3 days a week. Is this because fewer people require tests, or are vaccine efforts taking priority and workers needed to be reallocated to help there instead? Or is it both?
It is actually a bit of both. So we have seen decreased numbers as we've talked about on this briefing over the last number of weeks. And so understanding that, and also understanding that as of March 1st, we are opening up to a large group of individuals that need to be vaccinated. We wanted to be very mindful of our resources and where we have people to make sure that they are being used in an appropriate way. So yes, it is both. We'll be moving a number of staff over to the Wisconsin Center and into our mobile sites for vaccination.
Our next few questions come from Rory Linane with the Milwaukee Journal-Sentinel. I believe they're mostly specific to City of Milwaukee, but Rory, feel free to let me know if you'd like for all of Milwaukee County. The first question is, do you have an estimated timeline for all teachers to receive their first shots and second shots?
Yeah, so we know that it's going to take some time. So I can't necessarily say that we have an exact timeline. We're hoping to get most of the first shots and also into some second shots in the month of March. So we are moving as fast as we can. The other piece that we don't have a really good handle on always is what that real demand number is. And so ideally, we're going to have all of our teachers in line ready to get vaccinated. And so obviously, if that's the case, it'll take a little longer.
There's a few more questions, and Roy did clarify for the City of Milwaukee. So for Commissioner Jackson, how many educators and child care workers are eligible for the vaccine in Milwaukee? Do you have an estimate of how many of them won't want to get vaccinated? And I can go ahead and ask these other few since they're related to City of Milwaukee. Will you share information with schools about which staff are vaccinated or how many? And do staff have to work a certain number of hours per week to qualify for the vaccine?
Okay, I'm going to try to tackle those in order. So as it relates to how many educators, we anticipate between all of our MPS educator and support group, as well as our non-MPS and our early childhood workers, that is around 25,000 individuals who are eligible for vaccination starting March 1st. Obviously, we hope that all of them are planning on getting vaccinated. So we, as a health department, that's what we plan for. And we just will continue to watch those particular numbers. As it relates to sharing information, so our goal for understanding who has been vaccinated is not to share that information with individual schools, but for us to really make sure that from an accountability perspective, we are vaccinating the individuals that are supposed to be vaccinated. And then the question regarding a certain number of hours per week. So at this point, we have not made that separation or differentiation. If you are in the classroom educating children, or are planning to be in the classroom and are considered an educator, then you are eligible.
All right. I do believe those are all of the COVID specific questions I'm seeing in our chat. So at this point, we will end our briefing. Thank you all for the questions. Thank you all for your time today. Have a nice weekend, and we'll see you next week. Oh, wait. Mayan Silver with WUWM has a question coming in. Mayan, if you prefer to ask your question, certainly you can come off mute as well if that's easier.
Yes, I'm so sorry. I emailed you the question. I was just wondering, Director Roush had mentioned expecting the end of April for the educators category. I just wanted to check and make sure if that's the case. And then when are you expecting pre-existing conditions to get started when it comes to vaccines? I know that's kind of far down the line, but I'm just wondering if you have an estimate at this point.
Yeah, thanks for the question, Mayan. The state's goal, and they've talked about it on several of their own media briefings, and it's been publicized previously, is to complete all of the educators by the end of April. So that gives us, the next 8 weeks to do so. Certainly that could go faster if vaccine availability is there. We just don't know, but it is a good goal, and it certainly is a goal I think that Commissioner Jackson and I would support. It just really speaks to the limited vaccine that's available, and it's going to take some time. We've got thousands and thousands of teachers throughout Milwaukee County that need to get vaccinated in addition to other school staff. So that will take some time. We are hearing from the Department of Health Services that it sounds like the next eligible groups would start becoming eligible in April. But as of now, the SDMAC group, that advisory committee, has not made those recommendations that I am aware of. I don't know if Commissioner Jackson is aware of any of those next eligible groups yet. No. So we'll have to get back to you, or that's a good question to take to the folks at the Department of Health Services.
Thank you.
Thank you. And we do have one more question from Rory coming through, and it is for Commissioner Jackson. Did you request a certain number of doses specifically for vaccinating K-12 teachers, or is that included in the 10,000 dose request? Are a certain number of vaccines set aside for teachers?
So that 10,000 was that request in understanding that we were going to have that larger group eligible March 1st. And as it relates to setting aside, our goal is really to open up those schedules to educators and fill it up as much as we can.
Thank you for clarifying. At this time, those are all the questions. Next question is for Dr. Weston. And I'm sorry, it's mywisconsin.com. In some states, the health departments create COVID-19 clinics for treatment for patients. Is Milwaukee planning to create something similar?
I'm not sure what that's referencing of a treatment clinic. Certainly for treating patients who acutely have COVID and need medical treatment, our hospitals and our clinics have been doing an outstanding job and have a lot of capacity to take care of patients in need. I'm not sure if that answers the question.
Certainly, My Wisconsin, if you'd like to email me following the briefing, we'd be happy to provide additional detail if requested. So at this time, I think we are all set for today's briefing. Thank you all. Thank you for the questions. We'll see you next week.
Thanks, everyone.
Thank you.
Thank you.